Hi, ACR Convergence 2021. I'm Dr. Rachel Tate from West Palm Beach, Florida, and I just saw an interesting abstract number 0907, that I wanted to share with you. So there's a lot of controversy regarding non-radiographic AxSpA. Is it early AS? Does it even exist? Do patients respond to treatments like they do for AS? Do they progress to AS? You name it. We have lots of questions. So this study by Dr. Kieskamp et al. Reviewed 79 patients who were non-radiographic AxSpA for up to 6 years to determine radiographic progression to AS. So they operated under the initial dogma that we have that 10% of non-radiographic AxSpA patients will, over a 2-year period, progress to AS. All 79 patients who were at the baseline were non-radiographic AxSpA based on pelvic X-ray. Subsequent films were taken at years 2, 4, and 6 and read by 2 radiologists. And progression was determined based on the modified New York criteria. At baseline, we had 48% male patients, average age of 39, and symptoms started on average 6 years prior to enrollment into the study. And 71% of these patients were HLA-B27 positive. So at the 2-year mark, 8 of the patients met modified New York criteria for SI joint progression to AS. At year 4, we only had 48 patients who came back for repeat X-rays, but an additional 4 of those patients were then into the modified New York criteria for SI joint progression to AS. And at 6 years, we had only 24 patients that we could look at, but 3 of those patients on their films had progressed to meet criteria for SI joint progression to AS. So in my recollection, this is the first, if not one of the first studies that actually looks at kind of the long-term follow-up of these patients. And while this is a very small study, it kind of teaches me that this is a potential, that we really need to hone in on these patients and we need to treat them aggressively upfront and early. We clearly need to better understand if this segment responds to conventional therapies, as we believe that they do, and if there are any other further disease components that may lead us to the idea that progression is a possible outcome for each individual patient. For more ACR Convergence 2021 coverage, check out roomnow.com, and of course, follow me on Twitter @UpToTate.